It was on this day exactly 6 years ago that the World Health Organization declared the coronavirus outbreak to be a public health emergency of international concern. What followed was something most of us had never experienced before. Lockdowns of entire cities, tests and quarantines, mask wearing, travel restrictions, entire industries put on hold. And of course, many, many deaths. Health systems were stretched to their limits, so much so that doctors around the world were being forced to decide who should live and who should be left to die. Well, coronavirus, of course, causes Covid-19, a virus that spreads through the air and is highly infectious. The WHO declared the public health emergency to be over in May 2023. But by then, it had killed anywhere between 7 to possibly as many as 33 million people. At the start of the outbreak, there was no known cure for Covid-19. In fact, there still isn't. The vaccines were quickly developed and they have helped fight the worst of the symptoms. The pandemic does rank as the 5th deadliest in human history. And while Covid-19 still exists, the strains that have spread since the end of the pandemic, they've been far milder and therefore less deadly than previous ones. For example, in the middle of last year, Australia reported 58,000 cases of Covid, and that was with drastically reduced testing, so there were probably more. Let's go to the UK and speak to Dr. Bharat Pankhania, a senior clinical lecturer at the University of Exeter. And now, congratulations, Mr. Mayor of Bath. I'm 6 months at least out of the news, Dr. Pankhania. What do you remember?
Thank you very much, Adnan.
What do you remember?
I appreciate it.
What do you remember about the COVID-19 pandemic most in your mind? What really stands out for you in those few years?
Many things, but one thing that stands out in my mind is how afraid ordinary citizens of the world were. They were truly petrified and worried. We got our messaging so wrong, and therefore we worried so many people. We could have communicated better.
I was one of those. I was absolutely petrified. And I think, and I'm going to tell you something personal here, Doctor, okay? And I mean, I think it may be a case for a lot of people around the world. I think my fear transmitted itself to my young kids who have grown up with some kind of health anxieties. I mean, that's kind of almost normal. Nobody knew what this thing was going to do to us, and we just saw people dying and that there was no cure.
Yes, we went into panic mode. And the rules order was also abandoned. And at very short notice, we went into lockdown, understandably, but a lot of rules order was abandoned. And I feel we were underserved by politicians all over the globe. Some politicians did really well, some abysmally bad.
How prepared are we for the next one?
Well, I always like to look at it in a positive light, which is further to these experiences, the World Health Organization has set up a program referred to as PRET, which is Preparedness, Resilience for Emergency Threats, Emerging Threats, PRET. Now, because this is a coordinated effort by the WHO, asking member states to commit and be absolutely prepared, not only from an infectious disease point of view, but from logistics, resilience, practice, tabletop exercises, training. I feel a little bit better in that the World Health Organization, not individual governments, is taking the bigger initiative.
A journal connected to the Centers for Disease Control in the United States has identified the influenza D virus and the canine virus as possibly the next global pandemics. At the moment, we've got something called the Nipah virus spreading across India. The WHO says that probably Nipah won't spread to the rest of the world. But are we seeing more of these viruses than we ever have had before? Or is it just something we weren't paying attention to? I mean, you will have been, but we wouldn't have been, normal everyday citizens who don't have any medical background.
So with the advent of global warming, climate change, a lot of travel, furthermore, deforestation and humans entering animal territory, we expect to see more of the unusual infections becoming common. So for example, Nipah virus, that's caused by fruit bats. And the more we encroach into fruit bat territory, the greater the likelihood of picking up a deadly Nipah virus infection. So what is happening is mosquitoes that normally did not live in, for example, southern European countries and further up, are now starting to live there, and therefore we will get those new infections which before were not possible because it wasn't warm enough for those mosquitoes to live and survive, reproduce, and infect humans.
There was one analysis during the height of the pandemic which said that coronavirus will be with us during your grandchildren, my grandchildren's lifetimes as well. Just briefly, Doctor, if you don't mind, would you agree?
Yes, of course I would, because it is now in circulation, and every now and then it will mutate and cause a surge in infections and some deaths. But overall, the world is immunized or protected from coronaviruses because we have already encountered it. So I don't expect huge surge in cases in deaths, but we will definitely continue to have cases with occasional large number of cases.
Dr. and Mayor of the City of Bath, Dr. Bharat Pankania, thank you so much indeed. You always make us feel better because you know what you're talking about. Thanks so much.
My pleasure. Thank you.